Hi, I'm Dr. Debora Sokol of LMA GI Consultative Services, and I'm going to speak to you for a few minutes about diverticular disease. Diverticular are small pouches in the lining of the colon or large intestine that bulge outward through weak spots. A single pouch is called a diverticulum. The condition of having diverticula is called diverticulosis. About 10% of Americans older than 40 have diverticulosis. The condition becomes more common as people get older. Half of all people over 60 have diverticulosis. Diverticula are most common in the lower part of the large intestine called the sigmoid colon. When the pouches become inflamed, the condition is called diverticulitis. 10 to 25% of people with diverticulosis will develop diverticulitis at some point during their lifetime. Diverticulosis and diverticulitis together are called diverticular disease. Most people with diverticulosis do not have any discomfort or symptoms. Some people may experience crampy pain or discomfort in their lower abdomen, bloating, and constipation. Other conditions, such as irritable bowel syndrome, also known as IBS, and stomach ulcers may cause similar symptoms. So the symptoms do not necessarily mean a person has diverticulosis. People with chronic symptoms should visit their doctor to help determine the cause. Rectal bleeding from diverticula is a rare complication. We believe this bleeding is caused by a small blood vessel in a diverticulum that weakens and then bursts. When diverticular bleed, blood may appear in the toilet or in the stool. Bleeding can be severe, but it may stop by itself and not require treatment. A person who has bleeding from the rectum, even a small amount, should see their doctor soon. Often, colonoscopy is used to identify the site of bleeding. Sometimes the doctor may inject dye in an artery, a procedure called angiography, to identify and treat a diverticular bleed. If the bleeding does not stop, surgery may be necessary to remove the involved part of the colon. The most common symptom of diverticulitis is abdominal pain. The most common sign on exam is tenderness in the left lower side of the abdomen. Usually the pain is severe and comes on suddenly, but it can also be mild and become worse over several days. The intensity of the pain can fluctuate. A person may experience cramping, nausea, vomiting, fever, chills, or a change in bowel habits. Diverticulitis may be mild enough to treat with outpatient antibiotics. However, in more severe cases, a patient may need admission to the hospital for IV antibiotics, hydration, and bowel rest. Diverticulitis, an infected diverticulum, often clears up after a few days of treatment with antibiotics. If the infection gets worse, an abscess may form in the wall of the colon. This is a localized collection of pus that may cause swelling and destroy tissue. If an abscess is small and remains in the wall of the colon, it may clear up after treatment with antibiotics alone. If the abscess does not clear up with antibiotics, the doctor may need to drain it using a catheter, which is a small tube placed into the abscess through the skin. This process may be guided by ultrasound or CAT scan. Infected diverticula may develop perforations or tears. Sometimes the perforations can leak pus out of the colon and form a large abscess in the abdominal cavity, a condition called peritonitis. A person with peritonitis may be extremely ill with nausea, vomiting, fever, and abdominal tenderness. This condition requires immediate surgery to clean out the abdominal cavity and remove the damaged part of the colon. Without prompt treatment, peritonitis can be fatal. A fistula is an abnormal connection of tissue between two organs or between an organ and the skin. When damaged tissues come into contact with each other during infection, they sometimes stick together. If they heal that way, a fistula may form. When diverticulitis-related infection spreads outside the colon's tissue may stick to nearby tissue. The organs usually involved are the bladder, small intestine, and skin. The most common type of fistula occurs between the bladder and the colon. This type of fistula affects men more often than women. It can result in a severe, long-lasting infection of the urinary tract. The problem can be corrected with surgery to remove the fistula and the affected part of the colon. Scarring caused by infection may lead to partial or total blockage of the intestine, called intestinal obstruction. When the intestine is blocked, the colon is unable to move bowel contents normally. If the intestine is completely blocked, emergency surgery is necessary. Partial blockage is not an emergency, so the surgery to correct that can be planned. Although not proven, the dominant theory is that a low-fiber diet causes diverticular disease. The disease was first noticed in the U.S. in the early 1900s, around the same time processed foods were introduced into the American diet. Consumption of processed foods greatly reduced Americans' fiber intake. Diverticular disease is common in developed or industrialized countries, particularly the US, England, and Australia, where low-fiber diets are consumed. The disease is rare in Asia and Africa, where people mostly eat high-fiber diets. Fiber is the part of fruits, vegetables, and grains that the body cannot digest. Some fiber, called soluble fiber, dissolves easily in water. It takes on a soft, jelly-like texture in the intestines. Insoluble fiber passes almost unchanged through the intestines. Both kinds of fiber help prevent constipation by making stools soft and easy to pass. Constipation, or hard stool, may cause people to strain when passing stool during a bowel movement. Straining may cause increased pressure in the colon, which may cause the colon lining to bulge out through weak spots in the wall. These are diverticular. Lack of exercise also may be associated with a greater risk of forming diverticula, although the reasons for this are not well understood. Doctors are not certain what causes diverticula to become inflamed. The inflammation may begin when bacteria or stool are caught in the diverticula. An attack of diverticulitis can develop suddenly without warning. To diagnose diverticular disease, the doctor asks about medical history, does a physical exam, and may perform one or more diagnostic tests. Because most people do not have symptoms, diverticulosis is often found through tests ordered for another complaint. For example, diverticulosis is often found during a colonoscopy done to screen for colon cancer or polyps, or to evaluate complaints of pain or rectal bleeding. If diverticulitis is suspected, the doctor may order a CT scan. This scan is a non-invasive X-ray that produces cross-section images of the body. The doctor may inject dye into a vein, and the person may be given a similar mixture to swallow. The person lies on a table that slides into a donut-shaped machine. The CAT scan helps to show the complications of diverticulitis, such as perforations and abscesses, and also can evaluate the extent of diverticulosis. Increasing the amount of fiber in the diet may reduce symptoms of diverticulosis and prevent complications such as diverticulitis. Fiber keeps stools soft and lowers pressure inside the colon so that bowel contents can move through easily. The American Dietetic Association recommends consuming 20 to 35 grams of fiber each day. The table, What Foods Have Fiber, shows the amount of fiber in some foods that a person can easily add to the diet. This is available on the table for you to take with you. The doctor may also recommend taking a fiber product such as methylcellulose, Citracel, or psyllium metamucil 1 to 3 times a day. These products are available in powder, pill, or wafer form and provide 2 to 3.5 grams of fiber per dose. Fiber products should be taken with at least 8 ounces of water. In the past, avoidance of nuts, popcorn, seeds, pumpkin, caraway, and sesame seeds has been recommended by physicians out of fear that food particles could enter, block, or irritate a diverticula. However, no scientific data support this treatment measure. Eating a high-fiber diet is the only requirement emphasized across the medical literature. Eliminating specific foods is not necessary. The seeds in tomatoes, zucchini, cucumbers, strawberries, raspberries, as well as poppy seeds are considered harmless. People differ in the amount and types of foods that they can eat. Decisions about diet should be made based on what type of food works best for you. Keeping a food diary may help identify what foods cause symptoms. If cramps, bloating, and constipation are a problem, the doctor may prescribe a short course of pain medication. However, some actually cause constipation. Treatment of diverticulitis focuses on clearing up inflammation and infection, resting the colon, and preventing or minimizing complications. Depending on the severity of the symptoms, the doctor may recommend bed rest, oral antibiotics, a pain reliever, and a liquid diet. If symptoms ease after a few days, the doctor may recommend gradually increasing the amount of high-fiber food. Severe cases of diverticulitis with acute pain and complications will require a hospital stay. Most cases of severe diverticulitis are treated with IV antibiotics and a few days without food or drink to help the colon rest. In rare cases, surgery may be necessary. If symptoms of diverticulitis are frequent or the patient does not respond to antibiotics and bowel rest, the doctor may advise surgery. The surgeon removes the affected part of the colon and joins the remaining sections. This type of surgery, called colon resection, aims to prevent complications in future diverticulitis. The doctor may also recommend surgery for complications such as a fistula or partial intestinal obstruction. Immediate surgery may be necessary when the patient has other complications, such as perforation, a large abscess, peritonitis, complete obstruction, or severe bleeding. In these cases, 2 surgeries may be needed because it's not safe to rejoin an affected colon right away. During the first surgery, the surgeon cleans the infected abdominal cavity, removes a portion of the affected colon, and performs a temporary colostomy, creating an opening or stoma in the abdomen. The end of the colon is connected to the opening to allow normal eating while healing occurs. Stool is collected in a pouch attached to the stoma. In the second surgery, several months later, the surgeon rejoins the ends of the colon and closes the stoma. Diverticulosis occurs when small pouches called diverticula bulge outward throughout weak spots in the colon or large intestine. Most people with diverticulosis never have any discomfort or symptoms. Diverticula form when pressure builds inside the colon wall, usually because of constipation. The most likely cause of diverticulosis is a low-fiber diet because it increases constipation and pressure within the colon. For most people with diverticulosis, eating a high-fiber diet is the only treatment needed. Fiber intake can be increased by eating whole grain breads and cereals, fruits like apples and pears, vegetables such as peas, spinach, and squash, and starchy vegetables like kidneys and black beans. There is no need to avoid seeds, nuts, and popcorn. Diverticulitis occurs when the pouches become inflamed and cause pain and tenderness in the lower left side of the abdomen. Diverticulitis can lead to infections, tears, called perforations, or blockages in the colon. These complications always require treatment to prevent them from progressing and causing serious illness. Severe cases of diverticulitis with acute pain and complications will likely require a hospital stay. When a person has complications or does not respond to medication, surgery may ultimately be necessary. I hope this information has been useful and you now understand the definition, diagnosis, cause, and treatment of diverticular disease.